Okay, I think we're good to start. Hi, everyone. My name is Noor Nasrallah. I'm a surgical assistant and a member of Surg Kuwait, and I'll be hosting today's session. Today, we're having our second session of the ABCs of Research series, and it's titled How to Interpret Research Results. Our speaker today is Dr. Sara Yoha, and for those of you who are joining us for the first time, Dr. Sara is a consultant surgeon in Jabal Ahmed Hospital. She completed her residency and fellowship in breast reconstruction and aesthetic breast in Canada. Dr. Sara, welcome back. We're always happy to have you here with us.
Thank you so much. Thank you for the kind introduction, Dr. Noor. I really appreciate it. Welcome back to anyone who joined us last time, and for anyone that's joining us for the first time, welcome again. So this is part two.
Before we start, I just want to note that if anyone has any questions, please leave them in the Q&A section, and we'll answer them towards the end of the session. Also, if anyone would like to register for the next ABCs of Research, session, or any of Surg Kuwait sessions, you can find that in the chat panel. Okay, Dr. Sara, you can go ahead and start.
Okay, thank you. This second part is entitled Interpretation of Research Results. So it's it's really all about statistics, but I tried to not make the title too intimidating, so I tricked you. So the disclaimer here is I'm not a statistician. So if there are any people who are expert as statistician, please leave so I don't offend you. So just think of this talk as statistics for non-statistical people like me. And I apologize in advance for any inaccuracies. This is just meant to be quite broad so that if you read research papers or gonna write them, just giving you the main overviews. Okay, and just a reminder, the other talks in the series, we're gonna cover how to write a paper and how to publish research. Okay, so stay tuned. And okay, so interpreting the results section in a paper, what is it all about? So it's really about two things, which are, were the right statistical tests performed in a paper? And did we miss any important tests? And to answer that question really comes down to knowing what statistical tests do I need to perform on my data set. For instance, if you were writing a research paper. So the goal of these statistical tests really are to answer the following questions. As we said previously, research is all about comparing two groups. We have a group that gets an intervention and exposure and another group that doesn't. And we want to see, is there a difference? So three questions I want you to keep thinking about when you look at the statistical part of a research paper. One, are the groups different? Two, do we think the difference is real or is it due to chance? And the third component is, okay, if it is different and it's real, what is the size of the difference between the two groups? How different are they? Okay, and most statistical sections of research papers are trying to address these 3 points. So here's an overview of what we're going to talk about. So to answer those 3 questions, we're going to talk about number 1, summarizing statistical data. Number 2, we're going to talk about statistical tests, which is how do we find out if there's a difference between the groups. And the third component is going to talk about statistical ratios, which is really looking at what is the magnitude of a difference between different groups. So to start you off, here's just an example scenario of a typical problem you would see in a research paper. So in this example, we have group A and group B. Group A in black are the group that got the drugs, and group B is the group that didn't get a drug, like a placebo. And we want to look at a specific endpoint. So in this example, we said, what is the difference in mortality rate between group A, who received the drug, versus group B, who received the placebo? And again, back to the 3 questions. Is there a difference in mortality rate? Is this difference real? And how big is this difference? That's really what we want to answer when we look at these questions. So before you even begin comparing the mortality rate in our scenario between group A and group B, you need to answer the following questions, okay? Besides the outcome of interest, which is mortality rate in this scenario, the first question you want to answer are group A and B the same? I'm comparing two groups, but am I starting off with similar groups? Basically, are there any confounding variables in the two groups? And why is that important? Because, for example, if there are more over 80s in group A, they might cause the death rate to be higher regardless of your treatment. So it's really important whenever you look at a paper is to look at if this question was addressed statistically. When you look at research papers, they usually start with table 1 is always establishing what we call the baseline characteristics of the research groups. So for example, we have one column stating the variables between the two groups. So in this example, I put gender, age, BMI, hypertension, diabetes. And then here's group A, which is the drug group. And we pretend that the total is 100. And group B is the placebo group. So in this scenario, we want to look at the differences. So most of these tables will have results similar to this. So when I looked at how many males there were, well, 48%, 51%, you have the age, mean age stated, you have the percentage of diabetics. So when you look at the groups, what you really want to see is, are group A and B roughly the same or not? Okay. One thing to bear in mind is, why is the way this data summarized different for different variables? Okay. So in our example, I highlighted variables that are similar in similar colors. So if you notice, gender, like male, I have numbers and percentages. Similar for hypertension and diabetes, okay? When you look at age and BMI, you have a number plus and minus sign. So it's basically the means. And then for WBC levels, I have a number 6 and then a range of values. And the question is, why are they presented differently in these tables? So the reason is that data is summarized according to its type, okay? I know this is very basic, but I'm just gonna give a brief overview. So in terms of types of data, we tend to categorize them as either categorical variables. Those include variables that are tangibly different. For example, gender, male or female, hypertensive, yes or no, mortality, yes or no. So these we call categorical variables. They don't have decimal points. Numerical data is quantitative data. So it's things that you can measure using a measuring tape. Examples of this include height, they include weight, and they include lab values, okay? So as soon as you're presented with data or when you're presenting a research study, you want to categorize what type of data do I have. Note that numerical data can be converted to categorical data to make it easier to analyze. Okay, here I put an example of BMI. You know, lots of statistical tests are easier to conduct when data is categorical, and we'll talk about this later. So if you have numerical data and you want to use a statistical test, just convert it to categorical. And here's the example where BMI ranged from 21.3 to 38.9, and we converted it to normal, obese, overweight. Hence, using those cutoff, we were able to convert it to categorical data. Okay, so to start you off with the first quiz to make sure everyone's awake, we're gonna put a small poll where you get to answer some questions. Okay, so here's a question for everyone. Are the following variables, and I know this is very basic, variables categorical or numerical? So example 1 is socioeconomic class. So we have 1, 2, 3, 4. Then we have CRP levels. Then we have whether a patient is on warfarin or not. So I'll just give you a few minutes to answer that.
Okay, so we're gonna have a big question. Okay, we're just gonna wait a few more moments. Wait about 10 seconds more. Okay, just a few more seconds and we're going to end the poll.
Okay. Great. I think most of you got most of them correct. It was categorical, numerical, and categorical. So that's great. Thank you very much. Okay, moving on. Takes a while to get back. Okay. So back to how we summarize data according to its type. So as you saw in our table, what you do is you pick out the categorical variables, and the way we usually present categorical variables is we mention the frequency of the variable out of the total. So as you can see here, for people who are of male sex, we had 48 and 51. And then you state the percentage. So in this example, it was 48% and 51%. Same for hypertension and diabetes, which is how many people had it. So it was 2021, 1817. And then we have the percentage in brackets. So this is the way you would express it in a research paper. Next, look at numerical data. So how do we summarize numerical data? And this one is it's straightforward, but a little bit less straightforward. Well, it depends. So what we have to answer before we decide how to summarize that data is we ask the question, is the data normally distributed or is it not normally distributed? Okay, and these graphical depictions just show an example of what normally distributed data look like, which is that curve. Anything that doesn't look like that is not normally distributed. And to simplify it, normal distribution is if I plotted all my data points on a graph, does the graph shape look like a bell or not? If it looks like a bell, it's normally distributed. If it doesn't look like a bell, it's not normally distributed. So the question then is, how do I know if my data is normally distributed or not? Well, you have two options to answer that question. Option number one is tedious and would take you more time, which is plot all your data points on a graph and just look at it. The second option, which is what most people would do, is you use advanced statistical tests of normality. And those are available in statistical software. If you don't know how to do it, you can just ask a statistician to do it. So an example of these are the Shapiro-Wilk test or the Kolmogorov-Smirnov test. There's many more. If you wanted to interpret them, you want to know if the test is statistically significant, then your data is not normally distributed. And if it's not, it's the other way around. So once you run those tests, you can decide if your data is normally distributed or not. So how do we summarize data according to its type again? So we said we're going to decide if it's normally or not normally distributed. If your data is normally distributed, we're going to use means and standard deviations. And if it's not, we're going to use medians and interquartile ranges. Okay. So for normally distributed data, we said mean and standard deviation. I know this is very simple, but as you know, mean is just average, which is sum of your data divided by the number of data points. And standard deviation is really important. It's a measure of how spread out your data is. So it tells you how much variation you have from your mean. Just to go this into more detail. So standard deviation, if you see the diagram, we have the letter mu in the middle, which is the mean. And this little symbol means standard deviation, okay? So the larger the standard deviation, it means your data is more spread out from the mean. The smaller your standard deviation, the closer it is to the mean. So it's a measure of spread. And we use standard deviation to give us the confidence interval, okay? We use confidence intervals to tell us how precise is our data, how much of it is very close to the mean. Okay, and again, you can calculate this using statistical software. You don't need long formulas. We calculate the confidence intervals using standard deviation to give us a range of values that the mean falls under. So you can see in the diagram, one standard deviation means 68% of your data points are that close to the mean. Okay, if we say 2 standard deviation, we say the range covers 95% of your data points. 3 standard deviations means the range of numbers you're given gives you 99.7% of the data points above and below the mean. Okay, so like we said, if you calculate 2 standard deviations, which is what we usually do in papers, we get a range of values above and below the means, where 95% of our data is likely to contain the true population mean. And, you know, if you audit lots of research papers, sometimes they forget to include this, but it's really, really important. We'll talk about a lot more why. And confidence intervals in research papers are usually expressed as error bars, okay? I put some examples here. One of the examples is not so good, but if you see the bar graph, those 2 lines are the standard deviation. And in the diagram below that had calisthenics, walking, dancing, yoga, the dot is the mean and the error bars are the 95% confidence interval. And again, like we said, the narrower your confidence intervals are, the narrower the error bars are, the more certain we are that we're seeing a true effect. So narrow error bars that are what you're looking for. Okay. Next, what about how do we express this in our table? So like I said, again, we have age and BMI. You basically would put the mean for the groups. So here it's 38. And then 10 is like 1 standard deviation. So you put 1 plus minus and then the standard deviation. And then you would do the same for the second group. 37 plus or minus 2, 24 plus or minus 2, 24 plus or minus 3. Okay, so test of normality, it's normally distributed. This is how I'm gonna summarize it. If your data is not normally distributed, like we said, you're gonna use medians and interquartile ranges. As most of you know, median is basically you arrange your data from the smallest number to the largest number, and the number in the middle is your median. Interquartile range is the equivalent of standard deviation, but for medians. It's a measure how spread out your data is. What you do is you arrange your data again in numerical order. You divide it into a small group and the big group, and then you find the number in the middle, and that's your first quartile and the third quartile. And I'll show you a diagram that shows this better. Interquartile range is basically subtract your quartiles from each other, and it'll give you the interquartile range. So this is a diagram to show that. So here we have numbers from 62 to 81. The number in the middle is between 70 to 72. So your median is 71. You can see that we divided the groups to a lower half and an upper half. Quartile number 1 as a result is 64. Quartile 3 is 77. The interquartile range is 77 minus 64, which is 13. Okay. And we can express medians and interquartile ranges as box plots, as you can see. The minimum and maximum number in this case would be 62 and 81. So the range is basically your smallest number and your biggest number. And as you can see, we did our test of normality and white blood cell count was not normally distributed. So we have the median as number 6 for both of them. And the interquartile range, basically Q1 and Q3, quartile 1, quartile 3 are 4 to 8, 4 to 9. Usually you give the ranges to give people a flavor of how widespread your figures are from the median. So if you were gonna describe this table in the method section, you would say something like this. The data were checked for normality using the Kolmogorov, Smirnov, and Shapiro-Wilk tests. They were not normally distributed, so qualitative or categorical variables were expressed as numbers and percentages, and quantitative variables were expressed in medians and interquartile ranges. Sure, you can summarize it better, but basically this is how it would look like. Okay, so that's section 1 over with. I hope this was straightforward. The next one we're going to look at is statistical tests, which is answering the question, is there a difference between our groups? back to our baseline characteristics table, you notice I left an empty column. And our question is, okay, so now I have summarized data that shows me the groups are roughly similar, but how do I know for sure? Okay, so to answer the question, are groups A and B statistically significantly different? Like, are they different? Is it due to chance or not? What you can calculate is the p-value to tell you, are those numbers different between the two groups? So what is a p-value and how is it calculated? Okay, this is not a proper statistical definition because some of the definitions get into type 2 error and I just find it's too wordy. But like in simplicity, it's the probability that a difference between the groups is due to chance, okay? By convention, we set the threshold to 0.05. So just think of it, I know it's inaccurate, but as a 5% chance that any differences you see are not real. And we calculate p-values, as you know, using statistical tests, okay? And the question is, how do you choose what statistical tests to calculate the p-value? And the way I think of it is you're trying to match the data type that we categorize to the statistical tests, okay? Think of it as a dating service. So data types, we talked about categorical and numerical, normally distributed or not. The other things to talk about, are you comparing two groups? Or are you comparing more than two groups? Is your sample small? Is it large? Is your data paired? Is it unpaired? You have to match all these categories to one of the tests. There's more tests than that, way more. These are the most common ones you will see in research papers. Chi-squared, McNamara, Kruskal-Wallis, t-test, ANOVA, Fisher's exact test, Mann-Whitney. Okay, so let's do some matching. So the step number one, you're gonna say, is the data categorical or numerical? If your data is categorical, you're using one of the three tests that I listed there. You're either gonna use a chi-square, a Fisher's exact test, or McNamara's. If your data is numerical, you're gonna use either a t-test, ANOVA, Kruskal-Wallis, or Mann-Whitney. Of course, there's others, but these are the most common ones again. Step number two, for categorical data, you're gonna ask, is the sample size small, like less than 20? Is the data paired? And what do I mean by paired data? For example, if I was gonna compare a diagnostic test versus the gold standard in the same person. For example, I'm gonna test commercial swab to 3D printed swab. So you swab me twice. This is paired data because you're using the same test in the same person. Unpaired data is you're comparing a swab in me to somebody else. So now we're not paired, we're two different people. So for small sample sizes, for categorical data, you're gonna use Fisher's exact test. For paired data, you're gonna do McNamara's. And if you're comparing more than two groups and most other situations, or if you're not sure, chi-square is usually a safe bet for categorical data. For numerical data, you're gonna ask these two questions. Is the data normally distributed or not? And are you comparing two groups or more than two groups? Normally distributed data, we use what's called parametric tests. Not normally distributed, we use non-parametric tests. So the table just summarizes what test you choose based on the situation. So if you're comparing two groups and the data is not normally distributed, you will use Mann-Whitney. If it is normally distributed, you're gonna use a t-test. If you're comparing more than two groups and it's not normally distributed, you'll use Kruskal-Wallis. And if it is normally distributed and you're comparing more than two groups, you're gonna use ANOVA, okay? Remember this because there's a quiz coming up. Here's a summary of how you choose your statistical test to calculate the p-value. Is the data categorical or not? Once you decide, you're gonna pick one of those tests based on the situation, okay? So time for quiz 2. I think it's gonna come up soon. Okay, so for this quiz, you're gonna have 6 scenarios. Okay, I put a lot. And you're gonna pick the test basically. So question number 1 is if you were comparing the percentage of males in two groups, and it's a large sample, which of those tests are you going to pick? The options are going to be the same for every question. If you're comparing the mean age between two groups and they were normally distributed, what test would you choose? Number 3 is if you were comparing the mean BMI between two groups that were normally distributed. Number 4, if you're comparing the percentage of hypertensive patients between two groups and it was a small sample size. Number 5, comparing the percentage of diabetic patients between two groups and it's a large sample. And the last one is if you're comparing the median WBC levels between two groups that are not normally distributed. So I think you guys need a bit of time for that. So yeah.
Yeah, so we're going to give them more time to answer this question.
Mm-hmm.
We will wait until more people have answered the question.
Mm-hmm.
Don't worry if you don't know the answer, you can make an educated guess and we'll go through the answers with the Sarasara at the end.
Actually, is this helpful if I put the slide?
Yeah, that's probably very helpful.
Yeah.
Okay, just a few more seconds. Okay, so 10 more seconds and we'll end the poll. Okay, so this quiz is up. We can put the answers now.
Okay, so let's see. So you guys had comparing a percentage of males in two groups is a large sample size. Chi-squared is correct. I think most of you got it. Comparing mean age between two groups with a normal distribution. Most of you picked t-test, which is correct. Comparing BMI between two groups is a normal distribution. Majority got t-test, correct. comparing percentage of hypertensive patients, two groups, small sample size. Fisher's exact test is correct again for the majority. Comparing percentage of diabetic patients between two groups, large sample size, chi-square, most of you got it correct. And comparing the median WBC levels between two groups, not normally distributed. And again, most of you got it correct. It seemed like you were close between Kruskal-Wallis, but as we mentioned, two groups of men with new, more than two groups, it would have been Kruskal-Wallis. So good job, everyone. I hope that didn't scare most of you. Okay, just give it a second to restart again. So again, back to our table, we can see that the p-values are now all in. Most of the p-values are not significant in this table, which is good because for the table one, you want the groups to be identical in their variable characteristics. This is an example how that table would also be described in the method section. When you talk about the statistical test, you'll say the relationship between the explanatory variables and the outcome variables. For example, if it was death or ICU admission, were assessed using Mann-Whitney U test, t-test, x squared, for some of you who may not know, it just means chi-square test or Fisher's exact test. Okay, so down to our last part, which is talking about statistical ratios. And like we said, this is a measure of the magnitude of a difference between groups. So the goal of this test is basically to look at the strength of a relationship between variables. And like we said, we use ratios because ratios compares one thing to another. So you can look at the magnitude of a difference. Many types of ratios, again, in research papers. I just put the three that are the most common that you're likely to see if you are going to critically appraise a paper or write a paper. The most common is the odds ratio, which is the ratio of an event occurring versus an event not occurring. So I thought the diagram was a good way to show this. So blue circles over green circles. Relative risk is the risk of an event occurring within a group versus not. So the difference is really the denominator, okay? That's why relative risk tends to look at studies that look into the future, like prospective studies, because your denominator is bigger because you're looking at patients at risk of an exposure, not necessarily who had an event occurring. And then you have the hazard ratio, which you see in a lot of RCTs and prospective studies. Hazard ratio is the ratio of hazard rates. So the only difference between it and the other ratios is that now we've introduced the element of time. So we're looking at the probability of an event occurring in a group over time, okay? And what type of ratio should I use in my study to quantify the magnitude of an effect, okay? And what you do is you look at your study type, which we talked about in the previous talk, and then you select the appropriate ratio. This is not a set rule, this is just generalizations. Generally, if you're doing retrospective studies, you're gonna use odds ratios. If you're doing prospective studies, usually you'd use odds ratio or relative risk, depending on what you're looking at. And if you're doing a prospective study and you're interested in knowing about risks over specific time intervals, so now time is in the mix, then you're going to be using hazard ratios. How do we interpret ratios? I think it's straightforward. If a ratio is 1, that means you have an equal chance of something occurring in both groups. So 1 means there's absolutely no difference between the groups. If the ratio you're looking at is greater than 1, then an event is more likely in one group compared to the other. If your ratio is less than 1, then an event is less likely in one group compared to the other. Here's an example of what an odds ratio table would look like in a study, okay? In the first column, again, we have the variable. So this variable could be age above 50, obesity, smoking, hypertension, whatever it is you're looking at. In the next column, we have the odds ratio mortality. So age above 50, the ratio is 3.03, which means in our group, the odds for mortality are 3 times more likely in one group compared to the other. For obesity, it's 0.22, which means that the odds ratios, the odds are less in this group, almost like obesity is protective. Then we have smoking, hypertension, 2.1, 1.56. However, we can't just look at odds ratios without confidence intervals. So the next column is always the 95% confidence intervals. And these are the range of values above and below the mean. So here's the rule for ratios. If that interval contains the number 1, then it's not statistically significant. So in this example, age above 30, the odds ratio was 3.03. But the confidence intervals are between 0.58 to 5.81. So the number 1 is included in that range. So the p-value usually is not significant. For obesity, the range again includes number 1 because it's between 0.03 to 1.51. So again, the p-value is not significant. However, for smoking, we had 2.1. The range was 1.95 to 3.12. So this was the p-value was significant. And similarly for hypertension, 1.56, the p-value does not include the number 1, which gave us a significant p-value. So basically, the ratio informs us the odds of a variable, increasing the chance of an outcome occurring. So that's why we look at the confidence intervals, like we said. So in this example, only smoking and hypertension were statistically significant. So before we look at quiz 3, which will come up now, odds ratios and all ratios are usually expressed in this kind of diagram. Okay. I'm sure most of you have seen it, but basically your y-axis, you have variables that are described. So in this case, obesity, high triglyceride, low HDL, and the odds ratio are in the middle, in the x-axis, sorry. Here it goes from 0.2 to 5. And you have a vertical line going through 1, okay? Then you have each of the variables. So you have the mean and the standard deviation, okay? And for you to decide if one of these is statistically significant, you're looking for a variable that does not include the number 1. So this quiz is just gonna ask you, which of the following variables has an odds ratio that's likely to be statistically significant? So choose from one of these.
Okay, so like Dr. Sarah said, this is our third quiz. The question is, which of the following variables has an odds ratio that is likely to be statistically significant? And the first option is metabolic syndrome. Second is impaired glucose metabolism. Third is obesity. Fourth option is high triglycerides. And then you've got low HDL, hypertension, and albuminuria. Okay, we'll wait a few more seconds. Okay, 10 more seconds. So put your
Okay, great. So most of you got the correct answer, which is hypertension. And the reason is, if you look at hypertension, neither the mean, which is this line that's vertical, nor the ranges include the number one, whereas all the other ones do. Okay. Let's give it a minute to restart. Okay. So again, here's another example of the odds ratio. So in this example, I think I gave you a poll question for this one, but it's basically which of the following variables has an odds ratio that's likely to be statistically significant? And again, it's the same question. If you can pick out one of them. Oh yeah, I did put one. Okay.
So it's the same question, but different options?
Yep.
Okay, this one's a simple question, so just a few more seconds. Okay, everyone, let's put our final answers in.
Okay, yeah, half of you got that one, dancing, and it's simply because when you look at dancing, that vertical one line does not include it at all. And the odds ratio is 0.27, which means it's less like whatever happened is less likely in the dancing group. And if you look at the range of values, it's 0.09 to 0.75. So it does not include the number one at all. So that means it's the statistically significant one. Okay. Going back to our example, so we talked about, is there a difference in mortality rate in our table one? Then we talked about, is this difference real by doing our statistical test? And then we want to know how big is this difference? So using our example, if we were going to calculate the odds ratio, let's say in group A, there was a 5% mortality rate, and in group B, there was a 10% mortality rate, then the odds ratio is simply 5 divided by 10, so 0.5 or 50%. What if other confounders are influencing the mortality rate described above? What do we do about it? Okay, like we said, what if group B had more patients above the age of 80, resulting in a higher mortality? Do we just accept it, or how does it influence our odds ratio? So to correct for these other factors, you need to do something called multivariable logistic regression. You either have a statistical background or you ask a statistician to do this. And the purpose of this is to correct for other factors that can affect your outcome of interest. And in research papers, this is referred to as the adjusted odds ratio. Of note, logistic regression can only be used for binary outcomes. So if your data is numerical, you have to change it into categorical, and usually has to be yes or no. You know, death would be yes, no. Obese, BMI above 30, yes, no. Age above 50, yes, no. And how many variables can you adjust for? So as a rule of thumb, you have to follow a rule of tens for deciding how many variables to adjust for. So this is getting a little bit detailed, but it's the last detail I talk about odds ratios and regression analysis. So basically you use the event rate. So in our case, it's the percentage mortality rate to decide how many variables you can adjust for. So you don't do something called overfitting the model. I mean, if anyone's interested in overfitting, you can read about it. Won't go through with it today, but in our example, if you had 20 patients out of 100 that died during the study, you divide 20 by 10. So it means you can adjust technically for around 2 variables. In actuality, we tend to be more generous with how many variables we adjust for, sometimes 4 or 5. And this is something that if a reviewer was reading your paper, they might say, well, you overfitted your model because you included too many variables and your event rate is too low. So you'll see this being commented on. 2 more ratios we'll talk about. Relative risk ratio is actually very similar to odds ratio, except like we said, the denominator is different because you're looking at an at-risk group for the exposure of interest. So we're looking into the future. This has to be done in prospective studies, okay? 2 things I want you to calculate if anyone is interested to look at whether the results you're looking at have any clinical meaning, okay? One is the absolute risk reduction. And it's actually quite simple. You're just looking in the differences in the relative risk. So if there was 4% death in one group versus 2% in the other group, then it's 4 minus 2, which is 2%. So absolute risk reduction is 1 minus the other. It's nice to have that figure because you use it to calculate the number needed to treat. So the number needed to treat is 1 over your absolute risk reduction, or 100 divided by the percentage. So in this case, it's 1 over 0.02, which means 50. That means you need to treat 50 patients to see a meaningful clinical difference. Okay, that's all I'm going to say about relative risk ratio. Hazard ratio is basically, like we said, we're looking at the element of time. It's expressed, it's used in many other scenarios. Kaplan-Meier curves technically don't use hazard ratios, but they're part of survival analysis. Hazard ratio, you usually see it in something called a Cox proportional hazards analysis, which sounds really complicated, but they basically just look at the probability of an event occurring over time. So if you just think about it, how likely is it that an event occurs over time? That's what we're looking at. And again, it's looking at the hazard rates at different time intervals. So maybe you're looking at days, maybe you're looking at weeks, maybe you're looking at months. If a hazard ratio is significant, we're calculating using a Cox model regression coefficient, which you don't need to know how to do, you just need to know how to interpret p-values. And for survival analysis, we do something called the log rank test. Again, you don't need to even know how to calculate it. If you need it to be calculated, you can get a statistician to help you, or maybe you already know how. And then if you're reading research papers, like you just need to know the very basics, okay? Here's an example of how hazard ratios are expressed. And it doesn't matter what the study is. I just want you to look at the graph. So if you look at the x-axis, this is our time. So months since surgery, it goes from 0 months, 12 months, all the way to 72 months. So it means that in this study, they looked at people over like 3 years, okay? And then on the y-axis, you have the cumulative incidence of an event occurring. This event could be death, it could be whatever. In this case, it was thrombosis. So they looked at patients from day 0 to month 72. And then every time one of them got a thrombotic event, you can see the graph go higher and higher. Now, in this case, the patients in orange or red, they had no occlusion procedure performed, and the blue had an occlusion procedure. So what you see is the 2 curves separating. So this tells you, okay, there's a difference between these 2 groups. So this is from an article in the New England Journal of Medicine where patients with atrial fibrillation either underwent left atrial appendage occlusion during cardiac surgery or not. And then they looked at were they likely to get a thrombotic event or not. So in this case, the hazard ratio was 0.67. So having an occlusion was protective. And when we look at the confidence intervals, it's between 0.53 to 0.85. It doesn't include number 1. So it's statistically significant, and you can see that the p-value is 0.001. So that's how you would interpret it. So it's the same as the other ratios, except we added time to the picture. Here's another example of how you would do it. This is different. This is not hazard ratio. This is just survival analysis. So in survival analysis, in this paper, also from the New England Journal of Medicine, this is a paper that compared chlorhexidine prep to povidone iodine prep. So they had 409 patients in the chlorhexidine group and 440. In the x-axis, it's days to infection. So it goes 0 days, 5 days, 10 days, 25 days, 30 days. So they followed patients for 30 days. And on the y-axis is the probability of infection. So it goes from 0.5, 0.6, 0.7, 0.9 to 1. So survival analysis, you start with 1.0. So on day 0, nobody had infection. Everyone was infection-free. By day 5, maybe 97% of people had an infection versus the povidone, slightly less. And then when you get to day 30, it looks like the iodine group, 80-something% had some sort of infection, were infection-free, versus the chlorhexidine group appeared to have less infections. And as you can see, the p-value was 0.004. In survival analysis, which is what this is, you use the log rank test, okay? So that's all I'm gonna say about ratios. I'll give you some resources to look at if this is an area you'd like to be more familiar with. Just a few things to mention. What about missing data? This is something, if you're gonna critique an article, you look at. We lose data because sometimes we lose patients to follow up. And sometimes, you have incomplete information. For example, someone's filling in a survey and they miss most of the variables. So what do we do about it? Rule of thumb, if it's a small percentage that you have missing data for, we tend to just ignore it and maybe report it. If a large percentage of patients are missing, we just ignore the variable altogether usually. If you have around 25% missing data, technically you can use multiple imputation model, which you should do with caution. So if you see this in a paper, this can be a critique if you do that, because it sometimes leads to inaccuracies, but it's a tool at our disposal. So just to summarize, here is a checklist for evaluating the statistical reporting of results. So 7 things to think about. Number one, we talked about in our last lecture, was a power calculation used to determine the sample size? Number 2 is what we talked about early on, were the data summarized using appropriate methods? 3, were the correct statistical tests used to compare the variables between the groups? Number 4, was the correct ratio used to report the effect size of the differences between the groups? Number 5, were the appropriate figures used and were they labeled properly? Number 6 is really important. Were the confidence intervals reported? Because this tells you clinical significance. And number 7 is, was missing data accounted for appropriately? So I think if you look at the statistical part of a results section and you just run through these things, it will give you an idea of how well it was done. These are 2 resources I recommend. There's one called Medical Statistics, a common sense approach. It's like very easy to understand. And then if you wanted to do something a little bit more advanced, JAMA Guide to Statistics and Methods basically just gives you a good overview of many different types of studies. Thank you, and happy to take questions.
Okay, thank you, Dr. Sara, for a very educational session. It was a pleasure having you with us today. Thank you, everyone, for attending. We've got some questions. Would you like to read them, Dr. Sara, or would you like me to go through them?
Sure. So I can see 4 questions. One of them is when to use relative risk and odds ratio. I think we answered that in the talk. Odds ratios you can use for either retrospective or prospective studies. And then relative risk ratios tends to be prospective study where we have a group that's at risk of a certain exposure. Okay. Number 2, I guess, is which type of graph should we use for which variable? Okay, so it says, when do we use the box whisker plot and when do you use bar graphs? So bar graphs, I think you can use for means and standard deviation. And box whisker plots you can use for medians and interquartile ranges. That tends to be when you would use it. And then anonymous attendee says, which value of numbers needed to treat are considered good value? I think it depends on the clinical context, okay? For example, if you had a very expensive drug and it had a high risk profile, then your number needed to treat, to justify it, you'd need a much bigger number. If it was an intervention that had a low barrier to entry, you don't even need a big number needed to treat. You know, sometimes they do RCTs that are non-inferiority RCTs just to show that there's benefits, the treatments are the same, but this one is cheaper with less side effects. So as long as it's the same, then, you know, you don't need the big numbers needed to treat. Yes, thank you, Zainab, for attending.
Thank you, Dr. Saran. We look forward to having you with us in the upcoming two upcoming sessions of the ABCs of Research series. Thank you again. And thank you everyone for attending this session. If you'd like to just register for the next ABCs of Research sessions or any of Search Q8 sessions, you can scan the barcodes that are going to come up in just a little bit. All right, so you can scan the barcodes on the left side of the screen for the next two sessions. You can use the barcode for both sessions. Also, if you'd like to register for the surgical fix session next Sunday, it's going to be on JIS by Dr. Dimitra. And then also, if you'd like to register for the surgical debate, feel free to check out our website or our podcast or any of our social media outlets. It was great having you here with us today, and we look forward to having you on our next sessions. Thank you, everyone.